Hi, this is Dr. Robert Chao reporting live from ACR 2023 for Room Now. As we wrap up ACR, I wanted to share one more abstract here that really touches upon a subject that has been persistent throughout the past few years, which is enthesitis and the use of ultrasound. And this was abstract 2243. And this was based off of the original ultimate study, which was a 52-week study which demonstrated responsiveness of ultrasound-detected synovitis and enthesitis and psoriatic arthritis, and it confirmed secukinumab's efficacy in those regards. However, this study used the ultimate study to look at the relationship of ultrasound-detected enthesitis versus clinical enthesitis over time. In total, 166 patients were studied. In terms of clinical enthesitis, it was pretty much your old-fashioned, pointing to an enthesis area and asking, does it hurt, right? But they used a spark index here, which is an index of different enthesis sites. In terms of ultrasound enthesitis detection, of course, is by the ultrasound machine using powered Doppler across 6 sites bilaterally. And they found that over 52 weeks, both clinical enthesitis and ultrasound enthesitis had sustained resolution in over 50% in both arms. However, I think the most interesting finding here is that at the end, there was no correlation between clinical and ultrasound enthesitis. So I think, again, just like previous ACRs, it rings true that perhaps we need to reassess how we are assessing enthesitis. Maybe the kind of previous and traditional way of assessing enthesitis by just simply pressing and asking, does it hurt? I think it's becoming more and more clear, either we're missing or we're overdiagnosing, and it's hard to ascertain which side we're going. For me personally, I do think ultrasound is the way to go, especially in the tricky enthesitis areas. It does also provide, I think, to the patient, real world data to them, because usually they can see, whether it's by you or by a radiologist, they can see when an area lights up. Power Doppler is not something anyone's going to miss. If you see it light up with a power Doppler, it makes, I believe, the physician and the patient maybe a little bit more comfortable with the diagnosis, and also maybe a little more accepting of the drugs and therapies that we may introduce in the next meeting here. So thank you for tuning in once again to Room Now for live coverage of ACR 2023. And please follow me on Twitter at Dr. RBC. Thanks.